Mr. Sibanda, thank you for affording us this interview at Sly Media TV. My name is Shore Murwira. We understand that the Youth Apex Council wrote a letter to the Youth Service Commission body registering concerns about the health conditions of health workers. Can you please explain to us what are your grievances?
Our grievances are specifically meant for the employer. I'm not privy to share those grievances to the public, but the employer has the grievances, whom I'm sure they are going to attend in the due course.
Okay. Did you perhaps find time to sit down with the employer and address your issues?
It has been a long time before we met. So one of those things that we retain to our employer are the fact that we need to engage, to talk, and see where we can find each other. So maybe for the first time in a couple of months, we have met today, we have started the engagement, and we are happy about that. Although I would say there was adjournment to the meeting.
Okay, we understand that there are some negotiations which are currently going on. What if the government does not respond or give in to your demands? What's next?
The unfortunate thing is I don't decide on the next move. The people that I represent are the ones that are going to decide on the next move. I'm only a representation. I relay the information from the employees to the employer. That's where I stand. So if there is anything to come up, the employees will decide. And I only relay, my team and I will relay the information to the employer.
And the government yesterday said that they are not going to let you take an industrial action, or rather they will respond or address your issues. Do you believe that?
Come again.
The government said yesterday that they are not going to allow you to take an industrial action, or rather they are going to respond or address your issues. Do you see that happening, since you have said that it's been months you have been raising your issues?
Yeah, it's very possible that they can meet our demands or our grievances, to say, with the sincerity in negotiating. So, when you're negotiating, you have to have faith in each other, trust in each other, and also be sincere. We hope and trust that something better is going to come out through these negotiations.
Okay, would you care to explain, to give us a clear picture of maybe what the working conditions that you have been living in so far?
Impoverished.
How?
Poor salaries.
Would you care to explain more on poor salaries?
Below poor that line, that's a poor salary.
Okay. What other support that you might need, maybe from the general public?
Support from the general public?
Yes.
On our issues with the government?
Yes.
I don't think there is need for support.
There is need for that?
I don't think there is need for support. We're actually supporting the public so that they can get better healthcare services.
So in other way, you believe that the government is going to come in?
Yeah, it has to. There's no way out.
What if they don't?
They have to come. When a push comes to shove, the situation in this government is theirs. The people are theirs. We belong to the same government. They have to do something.
We have had some other issues back in the years where the government fired more than thousands of nurses when they protested. Are you not afraid of the likeliness of that issue to reoccur?
I don't know where you got it when you say thousands of nurses were fired. I don't remember that. When the government takes action to maybe to restore sanity, we cannot call that firing. Nobody was fired, but the government responded to a CGA that had taken place in their own way. We as workers, we have also the precision of the law on how to put our issues so that the government can hear us. So whatever happened back then, I don't think there was firing, because nobody was fired. Everybody is on board. Those who left might have left willingly, not to say somebody was fired.
Was fired.
Yes.
Okay, what if that their own way happens again? what is the thing that happens?
Which own way?
Their own way of not firing the health workers. What if it happens again and the government doesn't give in to your demands?
We'll still continue to engage. Our first port of call is to engage. We have been crying for engagement. Talk to us. Let's find ourselves. Let's talk to each other.
You spoke about incapacitation. Is money the only grievance that you are raising to your employer, or are there any other issues?
Let's look at the concerns that we are having. Some of these issues are non-monetary, to be precise. Most of the issues are non-monetary. But if there is no engagement, you may think everything revolves around money. That is not a point. There are things that we can discuss and map a way forward without money being chunked out.
Okay, can you maybe elaborate on that issue, on that other things that do not involve money?
There are many.
Maybe 3 of them.
You want me to give you 3?
Yes.
Okay. For a very good example, we're talking about provision of transport for the workers, provision of accommodation for the workers. To mention among the main that I can give you.
How long has it been going on?
What?
Your incapacitation, poor working conditions.
It has been going on for quite a long time, to be precise. You know, as workers, we always want more. That's the reality. Okay. But our situation is different. We are not pushing for more. We are pushing for the basic living salary or a basic living wage to get us out of poverty line, so that we can be able to fend for our families, among other things.
What impact do you think this industrial action will have on the healthcare system?
Devastating effects. You are talking to me right now because you are healthy. Yes. Because you're sort of being ill, going to the hospital, and then there's nobody to attend to you. What's going to happen? Probably you're going to die. So those are one of the simple effects that I can give to you. We'll be having people dying. And us as health workers, our call is to save lives. We'll never ever want to see anybody dying because there is no health worker to provide a service.
As we conclude this interview, Mr. Sibanda, do you have any words of wisdom would you like to share with our viewers as the President of Health Apex Council?
No, let's have hope that the ongoing impasse or the ongoing differences between the government employees in the health sector and the employer who wants to be the government is going to be resolved amicably without any job action. That's our cry. That's our hope. Let me highlight that we are very patriotic Zimbabweans. The unpatriotic ones left the country. But we are still here struggling to make ends meet for our people, for our patients, and for ourselves.
So do you think you are ready to keep on struggling, suppose the government doesn't give in to your demands?
We don't have an option. We have got only Zimbabwe in this universe as our home. We don't want to be living as second citizens or to be enslaved somewhere else. This is our home. We'll be here to see the positive changes coming up. And I'm sure our principalities, they know what we're talking about. They understand what we're talking about and how important it is